In the community that we live in, we have where there's probably between 70 and 80% renters. And so I think as people start or continue to move in and out of the neighborhood, it becomes difficult to sort of set root and build a relationship with some of these resources.
Hello, Ms. Favela. Thank you for joining us today. My name is Nelly Lopez. I'm one of the community health liaisons for the youth-driven Healthy South LA project and a student at Santee Education Complex.
Hello, my name is Yasmin Alonso. I'm also a community health liaison and I'm a student at Santee Education Complex.
Hi, Nelly and Yasmin. Thank you for having me today.
An upstream solution is one of the prevents problem at the source so we don't have to fix it. For example, addressing obesity or diabetes can be reduced through prevention by increasing access to physical activity or access to healthy foods in the community, and not so much looking at treating the problem after it's been diagnosed. Have you noticed any increase, decrease, or no change in any of these preventable conditions in the past 10 years in South LA?
Having grown up here is that it feels like I get the sense that there might be an increase. And I say there might be an increase only because it's been in the recent past that we've had, groceries come into the neighborhood where there hadn't been any in the last 25 to 30 years probably. And so I think that's helping to create some access to healthy food.
Social determinations of health are factors that influence the well-being of an individual. For example, housing, transportation, child development, the built environment, access to parks, safe streets, mental well-being, and jobs. What social determinations of health do you think pose the biggest challenges to improving the health and quality of life for residents of South Los Angeles?
In the community that we live in, we have where there's probably between 70 and 80% renters. And so I think as people start or continue to move in and out of the neighborhood, it becomes difficult to sort of set root and build a relationship with some of these resources. I think safety is another. If there's a perception that an area is not safe, people are probably less likely to walk and therefore maybe not access services. I think in the two communities that you're looking at, what you also find is that there was very poor planning done, right? So you'll find there could be a manufacturing company next to some housing, next to a recycling plant, next to a school, and so it makes it really difficult to control, what's being emitted out of those factories. For example, the Exide recycling center, right? They've been polluting in the community of Vernon for the last 25 years, and only now are we beginning to think about, how do we treat things like that?
So one of the questions is that we have, how would you rate the health and quality of here in life in South LA?
That's tough for me to give it an actual rating, only because I feel like I've had access to a lot of resources. So I think if I were rating it from a perspective from someone like my mom, she would probably give it, I don't know, on a scale of 1 to 10, 10 being the healthiest, maybe a 5. And I say that too because she also struggles with accessing health care.
What attempts to improve the health of South Los Angeles have been made in the past? Were they successful? Why?
I think some of the things that I think I would identify are the open space. I think there's been a lot of efforts to create open space in the area, to improve the existing open space. So for example, the wetlands, I think, are a big one, right? So every time I go, there's a lot of people there. Grocery stores, we saw at least two big ones open in the last 5 to 10 years. The Fresh and Easy came in. Fortunately, they closed. Superior stuck around, and then Northgate recently opened. So I think we have a lot more options, at least more options than we did at the beginning, in terms of access to healthy food. Now, is it affordable? That's still a big question mark for some people. And so I think there's some work that can be done around that.
Is there anything else we would consider when putting together a community action plan of these specific neighborhoods?
Recommendation to any of this work is, how do we bring your parents to the table too, right? How do we bring your friends to the table and begin to have some of this conversation so that they can help you better paint a picture of what they want to see? Because I think once that picture is painted and they can see themselves in it, then they're more likely to take advantage of it and to actually use what's there. Hi, I'm Azusena Favela. I'm on the neighborhood council. I'm on the South Central Neighborhood Council, and part of the work that we do is addressing some of the pressing issues in the community, like immigration, police brutality, and more recently, activating around the legalization of street vending. Part of the work that I do in the community is really figuring out how I can support some of the efforts that are taking place. My work specifically brings me around access to healthy food, access to financial institutions, and so how do we bring some of that into the communities where maybe it hasn't existed in the past. So that's part of the work that I do in the neighborhood council and part of the work that I do professionally. I've been living in the community for about 35 years in different parts, but for the most part in what we call Vernon Central. And so for me, it has been, I think for the most part, a positive experience. It's a place that I love and that I hold dear to my heart. So it's where I do my work, it's where I do my volunteer work, and so I'm working to change the perception of what our community looks like.